Hello, and welcome to another exciting episode of India's first and largest metabolic health conference, where we explore various health topics that not only impact our lives but can transform them for the better. I'm your host, Prasanna. I'm a certified low carb nutritionist and health coach. Today, we have a special guest, Dr. Vishwanath. Dr.
Yeah,
Vishwanath.
namaste. Yeah.
Dr. Vishwanath, a general physician, is a specialist in treating lifestyle diseases and medical conditions from the root cause with a holistic approach to wellness. Dr. Vishwanath has been successful in bringing back happiness into the lives of people through low carb lifestyle intervention and therapeutic fasting. Welcome to the conference, Doctor, and thank you so much for being here. We are looking forward to this conversation. So, to ask you with a question, so to start with, can you help our audience understand what lifestyle diseases are and why they have become so common in recent years?
So the common lifestyle diseases are like diabetes, hypertension, cardiovascular diseases, even osteoarthritis. Even nowadays, even autoimmune disease also is becoming a product of the lifestyle diseases. So diabetes itself can lead to many other diseases. So diabetes we called as a mother of all diseases.
Okay. This is quite interesting that we have, because a lot of our audience think that diabetes is a disease. And it's an interesting phrasing that we have that actually it is a lifestyle disease. So, interestingly, you have adopted a low carb way of eating as a solution to solving the lifestyle diseases such as type 2 diabetes. Can you please throw some light on how you came about that? A little bit of history about how it came.
So basically, I got interested in low carb nutrition because after reading a book by Jason Fung about the intermittent fasting. So I have one of my friend in the US. He's a radiation oncologist. He is doing this intermittent fasting from almost 15-20 years. So during my school days, after that, I want to study a little more on that, and I was little influenced by Jason Fung books and read about fasting. From there, I got an idea about low carb nutrition. The fallacy is in our MBBS, MD courses, there is not even a single subject which teaches about nutrition. You leave about low carb nutrition. Then when I started come to know about low carb nutrition, since I started my MD practice in 2008. So first 2-3 years, I was just treating diabetic patient like other doctors, like giving medications, just telling them you do walking and take this medication, you'll be okay. And sugars are okay. Then I realized that actually we are not treating diabetes. We are only treating the symptoms of diabetes. Like for example, somebody get a typhoid fever, the ideal treatment should be giving an antibody to treat the typhoid bacteria and the paracetamol to reduce the fever, but we are reducing only the blood sugars. We're not reducing the root cause. Then, out of my interest, I started studying more and more on low carb nutrition and started implementing on my own patients.
Okay.
So, and I even my family members, some of the diabetics and all. So, I got a very fantastic results after starting a low carb diet. Many of my patients, their dose is reduced by 50%.
Okay.
People were on insulin. It has almost they stopped the insulin, and I'll give a clear example. One of my classmate whose wife is a dentist, and he has shown to the well-known endocrinologist in Bangalore because she became a diabetic after her gestation diabetes. So at the age of 30 years, she was taking 2 insulins and 3 OHs.
Oh.
And she is basically Andhra style diet, like eating more of a rice.
You mean insulin injections, is it?
Yeah, insulin injections.
Okay.
When he consulted me for advice on this low carb diet, because he came to know I had done a small book called as Decoding Diabetes, and I started giving some social media messages regarding this. So he came to know about it and contacted me. I strictly advised her on low carb nutrition and diet modification to optimize protein as per the body weight and eat a lot of healthy fats. With this simple thing, within 2 months, she started getting hypo. So cut down her insulin and cut down her OHA. Now, within 8 months, she came to only metformin. Out of 3 OHAs and insulin, she came to only metformin. With that, her HbA1c was reduced from 11.5 to 6.5.
Wow.
So this I've seen in many patients. Then after late, we have some dietitians in Apollo. So I made my own center called Satva Preventive Health Center. In that, we have a specified low carb dietitian, and I have my diabetic remission programs. So especially results I've seen is people who are recently diagnosed diabetes, especially less than 3 to 4 or 5 years. Young people, they respond faster to low carb diet than the old people. Like somebody is diabetic more than 15, 16 years, already in the 50s, 60s age, for them, the dose can be reduced definitely, but complete reversal is little difficult. And another factor is they don't have that motivation also. The 55, 60 years following a different kind of a diet and stick on to it, and they're not motivated. They're kind of addicted to their own cultural habits. But especially young people less than 50 years who recently diagnosed diabetes less than 5 years, they respond fantastically to low carb diet.
Okay. And so we have been, thanks for sharing the success stories. And you have given an excellent success story. It's, I think it will be very useful for people to relate to. And can you please let us know what are the key principles, the basic fundamentals of low carb lifestyle, and how does it differ from other dietary approaches?
So I'll give a practical examples. So you'll take an Indian breakfast. Idli, dosa, upma, poha, paratha. So these are the common Indian breakfast across India. So North India, they prefer more of a parathas. And South India, they will more of idli, dosa kind of stuff.
And it will contain potatoes.
Yeah, potatoes. See, if you take any of these Indian breakfast, you think about the protein requirement. And normally, a 70 kg person need at least 70 grams of protein, active person.
Okay.
So that means to say a person need at least 20-25 grams of protein in every meal. But none of this Indian breakfast contain even 5 grams of protein.
Oh, not even 5 grams, is it?
Where it is? Suppose we have somebody's having idli, to 3-4. If they have some 3 to 4 idlis and with some chutney and sagu. The dal they use maximum they contain 5 grams. And in the lunch also, again they come to chapati, to roti, rice or chapati or sabji. And even with the non-vegetarians, they used to eat non-veg like once or twice a week. Only in that particular meal they get adequate proteins. And what about other two meals like breakfast and lunch? So whole as this, we are living in a high carb world. And people are eating almost 80% of the food as a carbohydrates.
Okay.
And as per the ICMR study, 85% of the vegetarians in India consume only 30 gram protein per day. That means to say it is less than 50% of their body requirement. So in this very simple way, what the people are eating first is shift from refined to a raw carbohydrates, some complex carbohydrates. And what they're eating 85% reduce to 40% at least. If not, cannot be 10 or less than 10%, reduce to 40% is first step number one. Reduce your carbohydrate from 85% to 40%. In remaining 60%, add 30% as a protein and 30% as a healthy fats. Even this itself will give fantastic results in terms of reduction of the weight, control of the diabetes, and overall energy and other things. And if the patient is successful in this, you can still reduce the percentage of the carbohydrates and then go to the next stage called keto. At least very few people are continue with the keto, but majority can continue with the low carb diet because it's a natural way of eating. The one thing I have to stress here is low carb, it's not something a new diet. Because our bodies are designed to eat 3 macronutrients in equilibrium. That's why God has given 3 macronutrients: carbohydrates, protein, and fat. Only if you eat them in equal proportion, we will be healthy. See, no nature, no culture nobody's told to eat 80% carbohydrate by neglecting protein and fat. People are scared of fat And people don't know what is really the protein. That's why they're eating carbohydrates. And of course, the carbohydrates are more tasty. And you can also make many recipes with the protein and fat if they have a proper knowledge about how to make the lifestyle changes.
Fantastic. So, in this, I saw that you are also advocating fasting. So, how is fasting overall as an overall treatment for lifestyle disease?
See, the nowadays all this obesity, diabetes, or even many cancers, for all these things, fundamental issue is high insulin levels.
Hmm.
Why people have hyperinsulinemia and insulin resistance is the first fundamental is one is high carb diet. Second causes could be a stress, a lifestyle, a pollution, and connecting away from the nature, like lack of grounding. All these things in mass give rise to insulin resistance. How low carb diet works? Suppose if I eat a 4 idlis in the breakfast, my sugar spikes. Pancreas will secrete insulin to control the sugars. Okay, that's done. Now my body has enough insulin, it has done. Again in the lunch, I had chapati, rice, and vegetables. Again, sugar spikes, insulin spikes, pancreas is secreting insulin to control my sugars.
Hmm.
Same thing in the dinner. Most of the Indians eat roti, rice, and other things. In this way, the pancreas keep on secreting insulin, become hyperinsulinemia. Okay, suppose instead of 4 idlis, what I did it, I stopped. I ate only 3 omelets, protein and a fat, and my sugar spike is less. My insulin requirement is also less.
Okay,
That is the
understood.
fun.
That
And
is the
if you have
fundamental.
some non-veg in the lunch with a lot of vegetables, again my sugar spike is less. Pancreas did not take in secrete insulin. Automatically, the insulin sensitivity improves,
Okay.
and insulin secretion come down, and insulin sensitivity improves. And suppose if you do fasting for 16 to 18 hours, there is no food at all. Obviously, no food, no insulin from the pancreas. It is still a fantastic way to improve high insulin and insulin sensitivity.
Okay. So basically, what you are saying is fasting becomes a little bit more easier when you are on a lower carbohydrate and good proteins and fats.
See, in my practical experience of last 8 years, people who follow low carb diet must do intermittent fasting, but the synergy is really good. If they follow both together, the results are fantastic for a pre-diabetic, even a diabetic people who are less than 7.5 HbA1c. Practical examples in my practice, what I do, any new person comes with a HbA1c of 7.5 up to 7.58. I don't start them on medications. And I'll assess the first thing we have to notice is whether the person is motivated or not. If the person is motivated, he have that attitude to follow the diet principles and insulin, I put him on strictly on low carb diet and intermittent fasting. And most of them will come with a normal HbA1c after 3 to 6 months.
Wow.
So this has been many people. I will give an example of a medical student who come to me 6 months ago. She was just 28 years, overweight, 73 kgs. Her fasting sugar was 300. And after food sugar was 450. And her HbA1c was 11.5. And she also has a PCOD issues. It was shocking. So she came to me and I told that, see, first anybody, since you have high HbA1c, you start on some small dose of OHAs. Along with that, you start low carb diet. So one misconception is when people are already on some major diabetic medication like sulfonylureas and other things, should not start them on a fasting. Because in Indian system, the following them was very, very difficult. The first thing is people who are already on medication first start the low carb diet strictly. So, and this girl, she's a medical intern. I started on low carb diet and exercise protocols. And within 1 month, she started getting hypoglycemia to my tablets. So then I reduced the tablet dose to 50%. Then within next 1 month, even for the 50% dosage, she started getting hypoglycemia. Then I said, you stop everything and follow only low carb diet. This happened 2.5 months after the dietary intervention. The sugars, fasting sugar from 300, it has came to 115 within 3 months. Now within 6 months, her HbA1c has dropped from 11 to 6.8. And next 3 months it is 5.8. Now she's with a 5.5 to 5.8 HbA1c in the last 1 year.
Wow.
And now the present weight is 60 kgs. She has lost 12 kgs, and without any medication, she's following this.
Fantastic. So it's really satisfying to hear the amount of suffering that is being solved for people.
Yes, really.
So thanks for sharing this, doctor. And one more thing is there any misconceptions about low carb? See, I'll tell you an example, because when we talk about this, there are many who come and say that for youngsters, they should eat a lot of carbohydrates. Youngsters means less than 18 in the growing stage. They should eat well. That is when they will get better. That is usually India. That is what people say, right? That is seen that across. So for them, low carb and all is not so great. That is the conception. I'm hearing these conversations. So could you please throw some light on this particular?
Yeah, this is happening in the kids, like children's. Matlab, you give them whatever they want, whether it's a chocolates, sweets, rice, whatever they want, give. And in today, the most unfortunate thing is, for many kids in India, Maggie is one of their breakfasts. We are got to such stage. And once somebody is pregnant, the conception is pregnant, matlab you eat anything and you put on weight. That means many girls think that pregnancy is an opportunity to binge eating.
You have to eat for 2 persons. That is the common.
Yeah. No, pregnancy, this other ways, many girls are very cautious about their weight. But in the pregnancy, they think that anyhow I have to gain the weight. Let us eat all the cravings. Though the craving, starting from the craving from the ice creams, chocolates to all these rice items and all, they start eating, put on weight. So this is a totally misconception. See, one is, when we start about naming it as a low carb diet, people always think that, okay, this person is treating me, giving some diet. And a lot of misconception about keto also. He is giving some diet. So other way of telling is, I convince these people like this is not something a diet. This is a natural way of eating. I will give an example. God has given 3 macronutrients. First, eat them in equilibrium. Then only your metabolism is okay. Second thing, you Google yourself and tell me what is the protein requirement as per your body weight. Even the Google says 0.8 to 1 gram for an active person. And if you're really good with the gym and other thing, you need more than that. Suppose you're 70 kg, what you need 70 grams of protein. And growing kids definitely need at least 1 gram per kg body weight protein. Okay, you're not doing that. And your body need healthy fats. So eat these healthy fats also in proportion. When we tell them that what we are teaching you, like something like a low carb or a keto, it's a natural way of eating. So many people get convinced that, oh, this person is not treating me another diet and all. And because once you start stressing more on, like, you follow low carb diet, you follow keto like this, then they get it. They have some doubts. Oh, some other dietist started telling, and many people are telling. I have consulted many dietitians. Sorry, I got some kind of. Yeah.
No problem. Yes, sir.
Yeah. So this is the way we have to convince them. And when we started realize them that you are eating 80% carbohydrate is unnatural, not eating protein is unnatural, then they're thinking that what they're eating is a junk food. And what we're really telling is a natural way of eating. This knowledge actually should spread across, so that low carb is a natural way of eating. It's not something, it's a dietary pattern, because you're not following the nature's principles. Nature only has given 3 macronutrients. Eat them at least in equilibrium.
Thanks. It means so much coming from a doctor. And actually, I was about to ask you that low carb, there is a stigma or mentality when we say that eat low carb, as you rightly said, right? So when we say diet, people have association from restriction, compulsion, and I think that is what you also touched upon. Am I right, sir?
Yes, correct.
So it is. People have a conception about it is a fad diet. It's some new thing. What is your take on that? New thing. It is not sustainable.
See, that's what this definitely when we started because majority people are not following low carb diet. Only few people are following low carb diet. So the society, we are a minority now. To convince a majority, it takes some time. And as the diabetes is increasing, only the people get convinced first with the results. So when we started applying this, when they started seeing the sugars, they themselves get convinced. So yesterday, one of my patients messaged me, today had only 4 eggs for the breakfast. My after food sugar is only 140. Otherwise, it used to be about 200. That simple one measurement has given him immense confidence in the low carb diet and also about me. So it takes some time. And we as a low carb community, like instead of promoting it as a diet, we must promote low carb diet. It's a natural way of eating. This is the physiological way the body needs the nutrition.
Fantastic.
So it's not it's not some other diet. Like people follow the liquid diet, the fruit only diet, something. This is something not a diet at all. This is a natural way of eating. The body is designed for that.
Thank you. Thanks. Thanks. It's so much of a relief to hear that it has to be promoted or it has to be stated as it is, as a natural way of eating.
Yes.
And in your opinion, what does the future hold for the low carb interventions? And
see, the low carb diet actually, in my opinion, I'm even thinking of putting a PL in the court, like why the government is not serious about dietary guidelines. And today, there's medical scam is there. There's people are promoting statins for the cholesterol, and even the American Diabetic Association get the funds from the Coke and Pepsi. So obviously, the medical research 50% is compromised. In this way, when we promote low carb diet and a fasting for a natural way, there's a lot of opposition because the mainstream medicine doesn't accept it. And second thing is, there is no subject on nutrition, whether you do MD, MBBS or DM. And majority of the allopathic practitioners who are not studied the nutrition may not accept all these things. But this is the future. This is the future. At least I'm eating high carb diet 80% in life. If not only the diabetes you meet, you're also getting 13 cancers, which is high insulin can lead to 13 cancers. And today we know that 13 cancers, there is infertility issues, so much major grievous situations are going on. And when this awareness started improving across the society, then automatically people should adopting it.
Okay. And one you have addressed and you have stated this, but for the listeners who are in many hundreds, they want a key takeaway, 3 items. What can I do right now just to reduce my suffering of all these lifestyle diseases? Can you please throw some?
My first thing is reduce your carbohydrate intake, and in that carbohydrate also completely cut down the refined carbohydrates and make it not more than 30% of your total meal intake. Remaining 60% eat a optimum protein as per your body weight. I recommend 1 gram per kg body weight. That's proper. And don't consider a dal as a good amount of protein. You consider a paneer, egg, and non-veg as a good amount of good proteins. Because if you take a green gram, even though it contains 28% of protein, it also contains significant amount of carbs. The carb load is optimum protein. And don't get scared of fat. Fat is healthy. There are 2 kinds of fats I always tell my patients. One is the God-made fats and one is man-made fats. See, all the refined oils are man-made fats. Whichever good healthy fat, it solidifies after normal temperature, whether it's a cold pressed coconut oil, whether it's a ghee. Eat healthy fats. Reduce your carbs, optimize your protein, eat healthy fats. And fourth, fast in a natural way. We have passed through 8 lakh years and 50,000 generations. In this 99% of the generation time, people have no access to light, no access to food after 6 o'clock. Once the dark is there. Only in this generation, people are eating at 10 o'clock, 9 o'clock. So natural way of eating, finish your dinner by 6:30, 7 o'clock. Have a late breakfast. That itself is intermittent fasting. This intermittent fasting, our ancestors are doing naturally. Today, it is a separate education. Did not do this intermittent fasting. You finish your dinner by 6:30, have a late breakfast by 11 o'clock. So this is second principle. First is low carb. Second is intermittent fasting. Third is connect with the nature, like grounding. Millions of years, human people have lived 75% outside, 30% inside. So earth grounding is one of the main ways we can connect to the earth and our chronic inflammation get reduced. Today, what people are doing, they use even slipper inside house also. Exposed to sunlight at least 30 minutes a day. Have a grounding 30 minutes a day. Connect to nature. Just relax yourself, reduce your stress. Like we are living in a polluted environment with high stress. So de-stress yourself, have a good sleep, follow low carb diet, follow intermittent fasting, connect to the nature. This is the key messages from my side.
Fantastic, sir. Thank you so much. And I would like to invite Mr. Shashikant Iyengar. Before that, I would like to thank you, Dr. Vishwanath, for sharing your valuable insights in this session, and for the enormous amount of work, the good work that you are doing in alleviating people out of suffering and completely reversing lifestyle diseases. Thank you.
Thank you. Thank you. Thank you.
On to Mr. Shashikant.
Yeah, I had to be unmuted. Sorry. Dr. Vishwanath, thank you very much for sharing your knowledge. We are so happy. And you have said a lot of critical things in this. The way you reduce carbohydrate in your patients stepwise, I think these are something which we can remember. And also what you told about once someone gets pregnant, then they think it is time to binge.
Yeah.
anything and everything. Very, very critical. Another very critical point you told is the Maggi noodles, which become the standard breakfast.
Yes.
I think these are all very, very critical. And I want to thank you personally for appearing. There's one question I'll ask because one of your fans have asked, is it possible that pancreas regeneration can happen?
See, the pancreas regeneration, it has two things. Somebody having a type 1 diabetes.
No, not type 1, type 2, let us say.
Type 2 diabetes, like people having a chronic pancreatitis because of that. And somebody is overweight. Because of the lifestyle, the pancreas has become dysfunctional. It is definitely partially possible if you adopt a good lifestyle. Okay. And so not only the diet, but partially possible. But I have seen some people with a chronic pancreatitis after following all these things, their dose has been reduced.
Okay.
But it all depends from person to person.
Fine. Thank you, doctor. Thanks, and thanks, Prasanna, for hosting this session very well. Now,